So Malcolm, in fact, that brings me to the next question, and I'll move quickly to looking at the future. But there's this prevention paradox that leaders have really faced, which is that when we invested in infrastructure and then you prevent the mishap from happening, then there's a lot of sense that that's wasted expenditure, that someone overcalled it, and there's a disgruntlement even there. And then you kind of dismantle that infrastructure. It's seen as wasteful spending. So how do you get around that? That if you set it up and you prevent the disaster, then that's also called a mistake of leadership, because you never know how bad it will get.
Yeah, I would say one of the big things to be doing for the future is investing in the science. I mean, let's look. I mean, the triumph of this pandemic has been the vaccines. And none of us foresaw how quickly we could develop those vaccines. I remember giving a speech in London back in March last year and having to say vaccines are at least 2 years away. Well, they're not. They've been remarkably produced. We've vaccinated, I think, something like 7 billion doses of the vaccine have been administered across the world. So I would say that's something that if we don't seize on that, if we don't now invest in further vaccine development for the future, then we've really lost the opportunity. If we can understand that science offers us a way out of the black hole of these terrible, terrible viruses, then we've missed a real opportunity.
Sorry, Sir Malcolm, some of your voice is dropping, so I'm having a little bit of trouble hearing you. But, broadly, I got what you were saying, which brings me to the sense of the expenditure and the spending, the priority that we give our health spending. So, I mentioned at the beginning that you sat over $130 billion budget for NHS, and yet there was difficulty in dealing with this, but just in terms of priority, and when you were mentioning that 7 billion people have been, that vaccines have been made available, I do want to share that though India went through a crazy, very, very devastating second wave, and there were a lot of mistakes made by the government, but 5 months later, India has administered 930 million vaccines, the US has done 400 million, UK has done 94 million. So can you help us understand a little bit, looking forward, that India just spends 1.2%, now it's gone up to 2.5% of the GDP on health, that what are the differences? What's the outcome? How much does UK spend? How much should India spend? And what is the outcomes we're looking at?
Gosh, that's such a big question. I could talk to you for a long time about that. There's no optimal figure. America wastes huge amounts of money on healthcare. America spends something like 18% of GDP on healthcare. And yet, if you look at the health profile of the United States, it's no better than the health profile of many countries that spend half that amount. India is going to have to invest more, there's no doubt about that. And to my mind, one of the lessons from the pandemic has been its incidence on people who have underlying serious health conditions. And in much of the Western world, those health conditions are reflected in obesity and in the type 2 diabetes that's so often associated with it. And this is where hospitalizations have occurred and a high mortality rate amongst vulnerable populations. So we need to invest more in our healthcare systems to try to improve the overall health of our populations.